Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am Jocelyn Turner. And typically, when I start, I talk about the weather in Northeast Florida. Well, I was alerted by our technology guy, who's also the behind the scenes technology guy, didn't know that he was also a meteorologist because he told me I can't say that the weather is good in Northeast Florida tonight, but it's better than it is in most places. How about that, Tyrone?
We'll let you pass for that today, but I need some more accurate information as we move forward.
Oh
For
boy.
all weather forecasters.
Oh boy. Well, welcome to all. Dr. Kane, how are you doing this evening? Did you put that dog away?
No, he left. Like I said, he's got a watch. He's looking at his watch, and he's going to leave me alone for right now. He was barking at one of the delivery guys, like, don't come in here. So,
Well, we are delighted, Dr. Kane, to have Maureen McGuinn. Poor Maureen, I heard her on a presentation. She did a presentation recently on the Cancer Collaborative for Northeast Florida, and she did such a great job talking about what the American Cancer Society is doing. And if any of you know, and I'm sure our audience does know, before I get into that plug, let me just go ahead and say, hey, Maureen, how are you doing this evening?
Hi, Jocelyn. I'm great. Thank you for having me. Thank you for having me tonight. It's great to be here.
Absolutely. Unfortunately, Maureen, you did a great job of talking about cancer and what the American Cancer Society is doing. I say unfortunately because if you follow the data like I do, it's amazing how cancer and heart disease flip flop as the number one and two leading causes of death, not only in Northeast Florida or in Florida, but in America, it seems, right? And Maureen, I don't want to be a naysayer, but I tell you, I'm just so convinced that a lot of the cancers that are out there are related to the products that we consume in terms of food and products. There's something now with African American women and hair relaxers, for example, right? And so just so much is linked to cancer nowadays. I know we're supposed to be talking about lung cancer, but I just had to say that. And you're shaking your head like, yeah, I know.
Mm-hmm. Yeah. I think you broke up a little bit when you were talking there, but I think, yeah, that's something that we're definitely always keeping an eye on. We're looking at all of the different ways that cancer occurs, and studying this and looking and seeing, is it food related? Is it environmental? Is it genetic? Is it, there's so many different reasons that people get cancer, but it is critical that we know all of those reasons and that we find those ways to prevent cancer and to stop cancer before it's spread, right? Before it's gone too far. So.
Yeah, and unfortunately, I can say that I've had a few family members that died of cancer. My dad, for example, died of lung cancer, and it was so interesting. It's so interesting the way the science goes. They told him that he had 1 year to live, Maureen. And do you know he lived 1 year? And sometimes I'm like, okay, so when somebody tells you have a year and that year is coming up, do you believe it, or you like, nah, I'm not believing that, right?
Yeah.
But I saw my dad's health failing, and unfortunately, he was a smoker. He had stopped smoking for over 35 years,
Wow.
and unfortunately, the cancer came back, and he had lung cancer probably about 15 years sooner or 10 years sooner in one lung, and he survived that, but then when it came back, unfortunately, he did not. So I know you and I both were just sharing our own personal our stories or family history of cancer. And whenever people get a cancer diagnosis, they automatically think that their life is going to end. But that's not always the case, is it?
It's not. And you know what? I like to think, what, if you don't mind, first, my apologies. I know we've talked about this before, but my condolences about your father. And it's
Thank
never
you.
easy to watch a loved one or a parent go through that, and then to hear that 1 year, some people don't even get that whole year. Some people get
Right.
less, some people get more. We really never know, And so if I think about the technology that's available now for people who are currently diagnosed with lung cancer, we're doing biomarker testing. We're doing all these amazing things that really personalize the treatment. And the advancements in lung cancer treatment have come so far, and they're continuing to improve every day, with lung cancer being the second most diagnosed cancer. This is critical for everyone in the cancer community to address this and to make sure that we're making progress. But also on the detection side of things, I wonder if this low dose CT screen existed when your father was diagnosed, or if it was something regularly, recommended or referred to. And so that's another point. On the prevention side, we have made so much progress, and the technology. Every screening facility in Jacksonville, in our area, has the technology to provide this screening. Doctors like Dr. Kane are referring their patients for these screenings on a regular basis now. So we are making a dent. We really are making a dent in the late stage diagnosis, which is critical to survival.
And I was saying no because Ms. Turner has said on the program before, I was her dad's doctor at the end of graduation into the afterlife.
Wow.
To a better place.
Mm-hmm.
Looking at things these days, definitely a better place.
Yeah.
But not without Jocelyn, so that's why she heard so much about it. But not like she want to go meet him just yet either. However, it was not present at the time. I welcome low dose CT scan, in which we can get into that conversation aspect. Dr. Kenneth Jones, general surgeon in this area. It's not necessarily lung cancer his specialty, but he sees a lot of those patients with some of the things that goes on as far as lung cancer is concerned, particularly when it comes to putting in port for chemotherapy and stuff of that nature. But long story short, it was not present. And if it had been, I think he would be alive today, because we have much better screening techniques. The treatment is much better. And the determination as to whether or not to treat or not to treat is much better than what it was. Back then we did a classification for lung cancer. It was either small cell or non-small cell. And now we can get into, and I'm not trying to steal any thunder on that, but now we can get into a much greater detailed diagnosis of lung cancer and its treatment. And without trying to be too detailish, it does make quite a difference as to the size, when it's diagnosed, the size of the lesions, and so on and so on and so on. Yeah. I'm sure that you and Dr. Jones will get into that. I see it every day, so I just want to add my little 2 cents in it, being the non-expert in this field. So I'll let you guys go forward.
Maureen, one thing that you said, I'm sorry, I got to stop you because I want you to address this. Yeah. And then you also share some information with us. I didn't realize that lung cancer is the second most common cancer in both men and women, and it happens most often in older people.
Mm-hmm. Yeah, and a lot of times we see, even it's non-smokers, there's this misconception that it's, that if you don't smoke, you can't get lung cancer, but that's not true. There are so many different factors that contribute to that: genetics, secondhand smoke, environmental causes. There are a lot of reasons why non-smokers also get lung cancer. So it's important that everyone be aware of symptoms and has conversations with their physician, about the status of their health. Are you having trouble breathing? Are you coughing a lot? Things like that. Because someone who's never smoked doesn't ever consider it. You don't ever think about, oh my gosh, this persistent cough could mean something. I should mention it to Dr. Jones or Dr. Kane next time I'm there. So those are just some examples. And I see Dr. Jones joined us.
Hey, Dr. Jones.
Hey,
hi.
Jones, how you doing?
Good.
Happy to have you.
Yes.
Hey,
always.
I'm happy to be here.
Yeah, so it's the not smoking, Maureen, that probably is harder. I mean, a cancer diagnosis of any, you know, for anyone is hard. But if you've never smoked, I'm sure it's quite shocking to people when they find out. Is it related to the environment in terms of, you know, I know there have been some pesticide situations and some other chemicals out there. I'm just wondering, and even, you know, even people who may not have been exposed via secondhand smoke.
Yeah.
Right.
Right.
Well, that's true. And, you know, people have to remember we live in a very polluted environment.
Yeah.
And as we all know, and everyone sees the lawyers requested, asbestos is one of the famous ones.
Yes.
Yeah.
Yes.
And people talk about asbestos, but there are so many others based on where people live and where they work. Exposure to arsenic, nickel, chromium, radon, all of those things that have been shown to increase your probability of developing lung cancer, even though you're not a smoker.
And, you know, Jacksonville has this whole big thing. What are these land fields that were covered up years ago? And you guys remember the days when we had the air pollution control, patrol, that it really stank around here. We were trying to figure out where it's coming from. And even though that was quite a few years ago, that had a lot of exposure to contaminants in the air. They never did want to. I think most of it they were saying was coming from north of us. You know, even though there was a place on the north side that was emitting those kind of chemical issues in the environment.
Well, remember before they closed the paper plant on the north side,
Exactly.
how the air was.
It was
Just
horrible.
think all those people living within that vicinity, what they were inhaling during that time. So I think as a community, you know, we have to spread this beyond just, hey, stop smoking, but change the environment where people are living. Because, you know, there's some data that shows that many times they said your exposure to smoking and your probability of lung cancer, that doesn't hold up in African-American males. African-American males don't have the long exposure. They die at a younger age, higher incidence of lung cancer. There's something maybe in the genetics of it all.
Yes.
In our exposure and how it happens. So there's a lot of research that still needs to be done. And the American Lung Association, American Cancer Society is trying to fund that type of research now, because we've got to look beyond, well, this person's a smoker and this person's exposed to smoke. But why is it that in this community of African-American men, without the prolonged exposure, they get lung cancer and they die at a younger age?
What I wonder, because we all know it, you know, there was a time in which the tobacco industry targeted African Americans. And one of the things that they recognized and what they did was they instilled menthol into the cigarettes. And we tended to smoke more of those. I think we tended to smoke and accept the harshness of smoking. You know, when you take your first inhalation of a cigarette, which I did at a younger age, it's like, why did I do that? You know, it's like I felt like I was going to implode inside. But then when I also got an exposure to, it was, you know, our favorite cigarettes at the club, you know, and places, nightclubs was Benson and Hedges 100 menthol. And by adding that menthol, it's been published pretty much and proven that it caused us to smoke sometimes more, okay? But we definitely got more of the contaminants in it because it was not as irritating to the lung passages. As a matter of fact, that menthol helped soothe it. So since it was targeted in our communities, I know that played a role. To what degree it played a role versus genetics, I think I don't look at versus as much as I do in addition to genetics. We have that. I think, Ken, that probably why we stand out quite a bit more, the genetics, and we were targeted for more acceptance of cigarette smoking by the cigarette industry, and worked in the tobacco fields to make that happen, especially early on in life. And I say early on, we did start at a young age years back. There, I guess they learned other ways of cropping the fields and yada yada yada. But it was a lot of us out there pulling that tobacco.
Mhm. Yeah.
Well, when they stopped television advertising of smoking, that did not prevent local print advertising in communities.
Mhm.
So think of the money that was spent on television now being directed into communities.
Joe
Where-
Camel and Cool Cigarettes and all those people were in the communities. They had billboards everywhere. They really, they doubled down on the print advertising, right?
Absolutely.
Right?
Absolutely. Yeah. Remember Joe Cool?
Yes.
Yeah. Cool.
He was all over the Black community.
Cool is the key word.
So,
just-
there's a lot of issues that we need. There's
With the
one
K.
data that I think I need to
It
mention.
made smoking cool.
Yeah. What you say, kid?
No, I was just saying, in smokers, smokers also are on medications for their cholesterol, and it has been documented that pharmaceutical doses of beta carotene increases lung cancer in smokers.
Wow.
So that data is well documented now. It has high, reproducibility. So I think that the people that are on HMG CoA, like artovastatin and stuff, then they take beta carotene, saying, well, I'm going to take this supplement to help out. Well, high doses of beta carotene have been shown to increase the probability of lung cancer in smokers.
And
what's the beta carotene for? I'm sorry, I'm lost.
Oh, people take that as a supplement,
right?
And they use it for, people say it's like to increase your energy to that.
Okay.
So,
and you see it in a lot of those vitamins. You see it in a lot of those vitamin products, JT. Ms. Turner.
Yeah, I just never knew what they were. I never knew what they were used for. If you're just tuning in, we're talking about lung cancer. It is Lung Cancer Awareness Month. One thing that's coming up soon, and I'm sure Maureen is going to get to it, is the Great American Smokeout. For those persons who have considered smoking and just don't know how to stop, help is available to you. Tips are available for you. Information. We are soon going to be joined by a former guest. When he was here before, he talked about his bout with COVID-19. He also has another story. I say he has a testimony, right? And so he's going to be dialing in soon. So I can't wait. If you need to go and grab a beverage or something, go and grab that beverage because he's going to be joining us shortly. So I'd like for you to tune in. Maureen.
Take that beverage quick because we still got information also, or hold it. I got mine in there. Just in case people who wonder what HMG that Ken was.
I'm sorry.
We're talking about the statins, cholesterol medicine, Lipitor, Crestor, Provocol, those things, just for those non-clinicians.
That helps because those are things that maybe we can educate community to make sure that you're telling your physician those things, you're telling your oncologist that you're using those things. That's where the communication, I think, between the medical providers is so critical for patients to understand that, you're seeing a new doctor and they might be communicating with your primary about what you're taking, et cetera. And then the other thing I was thinking, Dr. Jones, when you were speaking earlier about the outcomes for African-American men, if you think about this, the technology that's available, I mentioned earlier, biomarker testing, that's research. And it is critical that African-American people participate in research. And we know that there's stigma against that. And we know there's very good reason for that stigma. I'm not going to dismiss that, the history of that. But it's important that we have those conversations to say, hey, number one, have you had your low dose CT screen? Are you eligible for that? What's your pack year history? If you're not just smoking cigarettes, I was thinking about this too. We have guidelines that talk about if you smoke hookah, if you smoke cigarellos are in the language. Cigarellos have a different amount of nicotine, tar, all the things that cause lung cancer than the average cigarette. You're also not supposed to inhale those things. So if you're inhaling a cigar, your outcomes, your diagnosis, your staging, all those things might be different than somebody that's just smoking cigarettes, right? Not that either one is good. But that biomarker testing is such a critical thing that we are working on nationally and locally here. We're going to Tallahassee and we're pushing for funding for this and pushing to make sure that insurance covers it for everyone, not just people who have high quality insurance, but people who have, these marketplace plans and things that don't really cover everything. We're trying to get that covered for everyone because that research is so critical to customizing the care, which improves outcomes, which prevents cancer. It can cure someone of cancer, even if they have a later stage diagnosis. So it's very important.
To expand on what you said, screening, and you just mentioned, but low dose computerized tomography,
yes, sir,
is the actually gold standard for screening. But the question is, who needs to be screened? And the data says you're high risk if you have over 30 pack years, if you're a current smoker, or someone who has quit within the last 15 years.
Wow.
And I think that's very important that people understand. They say, oh, well, I quit 10 years ago.
Yeah.
I don't need to be screened. Oh, absolutely. Because the data has shown that if you identify it early enough, it's decreased lung cancer mortality by 20%. If you're one of these high-risk people who have gotten a low-dose computerized tomography, which is low-dose CT, which you may hear. But I think it's imperative that we understand that's the gold standard in screening for lung cancer.
And the good news with that, Dr. Jones, too, is that we just actually this month, we updated the guideline per the USPSTF guideline as well. So this screening eligibility, I'm reading, it's all still new to me. So I'm reading off of one of these fancy, I have a Plexi here on my table. So we've changed the recommendation from 54 to 74, I think is what it used to be, from 55 to 74, which 74 is such an odd number, right?
I couldn't understand that.
Doctors keep up with, right? I hear that we like round numbers in this community. So now it's 50 to 80 years old, right? So that we've expanded it on the younger side of things, so 5 years younger. And then we've gone a little further and we've said, because people are living longer, so it makes sense if you're eligible for this screening, you should continue to do it until you're 80, right? We're saying if you currently smoke or use tobacco, and we've reduced that pack year from 30 to 20. So now people who have a 20-year pack history, probably, some of the people that we talked about earlier who might be smoking cigarillos and things like that, they might be eligible now. Instead, they weren't. So that's great to know. And then the other thing is that 15-year, we took that off because saying, oh, it's been 15 years or more since you quit, you don't need it. No, if you've ever smoked ever, you need to take this screening. You need to talk to your doctor, have the informed decision conversation and figure out if it's right for you and then get it scheduled.
What I always believe that
I'm sorry, one question and then either of you can answer it. What about if you didn't smoke, but you live with a smoker? Should you also be one that gets screened?
You should tell your physician about that for sure. And then they can help you figure out if it's necessary. Absolutely.
There's no real guideline to that. There is, you guys can correct me if I'm mistaken, but as a primary care physician, I use my discretion as to whether or not I want to include these people in it. Because, one of the questions I asked, did your parents smoke when you were living with them? How long did you live with them? Did they smoke in the house? Did they smoke in the car? All that is second, and not just your parents, but I have one lady whose spouse, I diagnosed him with lung cancer. This man smoked 3 to 4 packs of cigarettes a day in the house. And so she was steadily inhaling that cigarette smoke. Well, that's equivalent to smoking, herself for those number of years. And ironically, she has some of the worst lung disease that for somebody who does not smoke. She's got polyps and cysts and all these things in her lung. We have not diagnosed her with lung cancer, but of course that was a consideration when she was developing all these lung issues. So that is very important. I think, back in the day, we did not consider secondhand smoke. Yeah. The insurance industry hid it, not insurance industry. Tobacco industry hid it from us. And we just never, when I say back in the day, long time ago, we did not look at those kids who were exposed to secondhand smoke. That's one of the things that those kids are now adults. I look at all the time. I can't say I'm not going to confess to a crime on that on any kind of a broadcast, but I took all that in consideration, and those guidelines were too limited. And I'm happy that they did expand them, but they were too limited at that time. And I had to use physician discretion in terms of who I wanted to screen for these low-dose CT scan. Because
that's the question I'm going to ask, Rogers. When we go into the EMR, it can say colon cancer screening, and you could send someone for a colonoscopy.
Right.
When you say lung cancer screening, I've never seen that part on an EMR any place.
It's not.
And, that means you have to get a diagnosis and then request authorization for that test. How easy it is to get low-dose computerized tomography by what's saying this person is high risk for lung cancer. I mean, I wish I could talk to someone in the insurance industry and see if that's one that gets an automatic authorization.
They do not. Well, I haven't had it to where they do. They have. And Maureen, you can maybe be able to enlighten us on some of that. I think you have a PowerPoint presentation that we can do, that we can show. But one of my thing is, because it was so limited, Ken, with like what you're saying, it was so restricted. And even though the Affordable Care Act, and one of the great things about it is that they allow for this this cancer screening, and that the insurance would have to pay for it, and the people couldn't deny it if you could prove that they needed the screening. So that was one of the good things about the Affordable Care Act. There was a lot of good things, but that's one of the good
Well, Maureen, right now they have not upgraded that 30-pack year. The insurance companies don't have it on that. They still have it at 30-pack years.
Yes, sir. That's correct, Dr. Jones. I believe that change will officially take effect for payers starting in 2024.
2024, right.
And I'll get that confirmation for you as well for follow-up if it's 2024 or 2025. But I'm pretty sure it's 2024.
And there are some people, actually, it's in New York. One of the centers in New York, I forgot which one it was. New York, whatever. One of those high-polluting medical schools in New York. They're actually pushing for even more relaxed, when I say relaxed, guidelines in which that they can start screening that 20 year for sure they're pushing for. If it not had been officially done, they're pushing for those 20 years in terms of trying to get people to be able to be screened at a less restricted pattern. And I can provide those. I think it's probably going to go through, but I provide those guidelines in terms of what they're pushing for in our podcast summary.
So I would like to pause for a moment as we pause for the truth. And thank you. This is a great discussion. If you're just tuning in, we're talking about lung cancer, and maybe you are not a smoker. However, you know a smoker. We like to pause at 7 p.m. to give our history maker moment. So Maureen, Dr. Jones, don't go anywhere. Just bear with us as we share a little history for our audience. Take it away, Tyrone.
For the Truth History Makers Minute, November 14th, 2023. As we reflect on the past and present, it is important to recognize the people who have made significant contributions to America and the rest of the world. Today we present to you, Dr. Robert Wynn. Dr. Robert Wynn becomes the first African American cancer director at VCU Massey Cancer Center. Wynn was born and raised in Buffalo, New York. He was the first member of his family to attend college. He started studying psychology at the University of Notre Dame, where he was supported by a football scholarship. He was encouraged to train as a physician and completed a bachelor's degree in medicine at the University of Michigan. At Michigan, he was taught by Francis Collins, who inspired him to combine clinical practice and academic research. He specialized in internal medicine and completed an internship and residency at Rush University Medical Center. Citation needed. Wynn was then a fellow in pulmonary medicine at the University of Colorado Health Sciences Center. He became interested in lung cancer. At the time, the only treatments available were based on cisplatin, and the outcomes were not good. Of the more than 1,500 cancer centers in the country, only a select few are considered by the National Cancer Institute as designated centers to lead research and training. VCU Massey Cancer Center is in that upper echelon. Now they have a new director who wants to take Massey even higher. Dr. Robert Wynn is a pulmonologist, which is a physician specializing in the respiratory system, who loves science and loves research. He has a focus on lung cancer and was in high demand while working at the University of Illinois Cancer Center. They had the science talent, the clinicians who are wonderful, the infrastructure, and more importantly, they really wanted me to actually have a big impact on the people in the community. I couldn't say no to a leadership team like that, Dr. Wynn said. Assassinations. The committee's final report, released in March 1979, stated that the Secret Service was deficient in the performance of its duties in Dallas.
What?
Bolden.
Uh-oh.
Looks like our technology guy, Dr. Kane, Tyrone really never messes up. So now we finally, you and I have messed up. So I'm glad that he finally had a little snafu. But nonetheless, good information about Dr. Wynn, and Dr. Tyrone does a great job in really trying to showcase someone who's made a significant contribution in the area based on the topic. So thank you, Tyrone, behind the scenes guy, for doing that history maker moment for us. Tyrone, also, is our guest ready to dial in before we continue the discussion?
Well, dialing in, JT, but also let's go ahead and put Miss
He was
McGuinn.
Dr. Kane, he was about to dial in. That's why I asked Tyrone, is he ready yet?
Yeah, I wanted that PowerPoint presentation to bring forth, because that may represent other areas of discussion.
I think we were going to share the PowerPoint as follow-up. I don't know if we wanted to go through like all the
Right.
per se.
Okay.
We can scroll through though if you wanted to look at some that have points that you wanted to.
Well, I didn't know, whatever order you guys see fit. I wasn't aware of the follow-up part.
Well, oh no, I've already been asking you questions from it. One thing that we have not talked about, by the way, and Tyrone, you don't have to pull the presentation up, she said. One thing that we didn't talk about, and this is for any of you, are there symptoms of lung cancer? If so, what are those symptoms?
I mean, from the medical perspective, you can have a persistent cough. You can have shortness of breath. There can be wheezing, constant fatigue, chest pain, weight loss, or what you may say, recurrent pneumonias that are not getting better. If somebody shows up in your office, like if they do it and I hear the history, I pack them off to Dr. Kane and let him work them up. But it's not something we work up. But if you said I've had like 4 bouts of pneumonia in the last 6 months and you have not had a low dose CT of the chest, something is missing. But I normally would not order that. I would send them to like Dr. Kane with a note saying, please evaluate this patient, persistent, recurrent, quote, pneumonias. And it's interesting. That's how my mother, who passed from metastatic lung cancer, who never smoked, but had pneumonia, and she was admitted about 3 times. And then I called the doctor where she was living and said, what does her CT show? And she said, well, I don't think she needs. I said, you know what? I would like for you to get a CT. And she eventually got it, and she did have lung cancer.
And I do. Oh, go ahead, Ken. I'm sorry.
5 years or so after that, but she died of her lung cancer.
And I've offered those condolences many a time, but I've never. When patients like that come in, and Ken has already made me aware of what's going on with that patient, it becomes a little bit more easier for me to, as a diagnostician, and what directions I need to do, I need to go. Where I run into problems at is, as what he did, is where people have not taken seriously, some people for whatever reasons, about the cough, about the recurrency of quote unquote bronchitis, or and those diagnoses of bronchitis were given. Sometimes they're in institutions where you may only be seeing residents. Sometimes they're in places where, and particularly, I'll be frank with you, women and African Americans are taken for granted in terms of their complaints, and these people don't really investigate as to what may be the cause of their coughing. And if they don't sit back and take a decent smoking history or decent exposure to other related diagnosis and or exposure to the elements, either secondhand smoke or community. They don't take all that in consideration and go looking, then they won't find anything. And one of the things that we do also, I see also, is what we call incidental finding of certain nodules, in their x-rays, as well as incidental finding in certain CAT scans and stuff of that nature. And incidental just means we were trying to look at something else. It could have been a kidney stone, looking for kidney stone or something else. But we actually find something odd on their CT scan. And if it's me or Dr. Jones, I know Dr. Jones, I know how he practiced, and I know if he saw that incidental finding of a certain character, he would go on ahead and pursue it or ask me to pursue it. Other people see it and just blow it off because, nodules represent something. And I didn't want to get into as much specifics about looking at a chest x-ray or CT scan and seeing a nodule. But those nodules, it depends on the size of the nodule, the presentation of the nodule, whether it has something called a ground glass appearance, which may, if it occurs at a certain size, it may be we're going to consider ground glass to be pre-malignant, being something that not yet cancer, but before you can actually call it cancer. And if you don't look into it, then you wake up 4 years later and this person has lung cancer. Solid nodules, the size of the nodules, all of those things matter as to how you work them up further and how you continue to follow up with them. I'm not going to try to get into too much specifics along size of nodules and stuff, because that's not as important to patients in terms of going through each and every last one of them. But we will, I think that I should put it in our website so patients, if they hear their physician say, oh, you got a small nodule, it's less than a centimeter, how do you pursue that? How should your physician pursue that? I would hope that they're qualified and smart enough to go and look and see what the pursuit is, as recommended either by the American Lung Association or American Cancer Society or American Society of Thoracic Surgeons, and so on and so on, and so American Family Practice, whatever it may be, to go look at the requirements or the recommendations for how to pursue any nodules that show up either in a CT scan or a chest x-ray. And I'm not sure if either, I guess, want to point out the difference between chest x-ray, Ken, you may want to get into it, chest x-ray versus CT scan as to the presence of nodules and what they may represent.
I want to add one thing to what you said about not taking it seriously, because when I called the physician taking care of my mom, the first thing she told me, but she has never smoked.
Right.
I said, okay, but she grew up in the West Indies, and you know what a lot of West Indians houses had back when my mom was growing up?
What's that?
Mosquito coils.
Oh.
Yeah.
I mean, every room had a mosquito coil. if you're out, unless you're under the mosquito net, when you're out, there are mosquito coils in the rooms keeping the mosquitoes away, because they'll literally bite you, pick you up, and fly you out the door. I mean, they're that big. And I said to her, I said, well, she grew up in Barbados and Guyana, and it's a little different. There are things like mosquito coils that they used a lot and things like that. And, finally had to convince her to get the CT.
Mhm.
And, if anyone has seen what a CAT scan looks like, you lie down. It's like you go into like this little tube. They're very fast today. I mean, you could get a chest CT in less than 5 minutes, and they're out of there.
Oh.
So that's easy. A chest X-ray is when you stand up and take a deep breath, but the data does not show that chest X-ray and sputum cytology in making the diagnosis of lung cancer is very, very, very low.
Right.
So the
Right.
best screening is still that CT, low dose CT scan.
And Ken, since you mentioned that about the mosquito coils, I give you a similar story. My wife, my mother-in-law, really, really nice lady, just the sweetest she can be. The problem that she was a hairdresser. And one of the things with hairdressers, back in the day especially, I'm not just talking about the chemical elements as Ms. Turner mentioned, but what did they do back in the day? They had those hot coils, hot combs that they put in, and they would also put in the petroleum jelly or whatever the heck they use, Royal Crown, whatever they use to allow them to be able to straighten their hair. So those people would be in a confined area inhaling the smoke that came up from, I call it frying their hair, because you got oil and and you got heat. So that's frying. But back in those days that you used a lot of
Rogers, don't forget how they heated them up. Sometimes they had
on the stove. Yes.
That's right.
On the stove.
That's right.
Maureen, let's talk about the Great American Smokeout.
Yeah.
Tell our audience a little bit about that and what resources are available for people who really want to stop smoking or want their loved one to stop smoking.
Absolutely. So the third Thursday of every November, usually the Thursday before Thanksgiving, is the Great American Smokeout. We call it GASO. And so all of our hospital partners across this area here, they're setting up tables and doing outreach, and just it's a day to get people to commit to quitting smoking. So we're asking you to make the commitment. We have quick cards that you can sign a commitment to say, I want to quit. And then we will connect you to resources. We have online resources, but here in Northeast Florida, we refer to Tobacco Free Florida. So that would be a referral to AHEC to help those anyone who commits to sign up for a program to get any support that they need to help them with their quit journey. And the number one thing is just to make that commitment. We have a toolkit. We have tons of great resources, flyers that I've shared with you that we can share with everyone after the call today.
So is there a number, Maureen, that they need to dial in on? Is that something, but Tyrone, he can look it up, Great American Smokeout.
And we have actually a link to a website that you can go to, and that can get you any resources that you need. And then I would just connect with your local hospital, with your physician's office to see if they're participating in anything. And then you can look on the website as well. They're kind of grassroots efforts. We kind of go out in the field and work with, lung navigators and people like that. So I know Dr. Jones, I believe you're at St. Vincent's. I know that the lung navigator at St. Vincent's is working on an event at Publix. I know a lot of our systems in the area are working on those initiatives. You might see people at tables on Thursday, encouraging people. And then of course, our friends at Tobacco Free Florida support that on the back end. And so they're going to be getting a lot of referrals this week, I hope.
So Maureen, tell me, I have this week alone, about 3 patients. I said, when you quit smoking, I'll do your surgery. And one guy said, well, it's going to take me a couple of months. One person said, I don't know. What do we have where I can say, hey, take this, call this number, and someone will help walk you through this? Because I'll be honest with you, if someone were to ask me that question right now, all I'm going to say is try tobacco-free Florida.
Yes,
I mean,
that is
is
the
that
number.
like tobaccofreeflorida.org? I mean, what is it?
It's the it's 1-800-QUIT, I believe, and we
Oh,
can get
boy.
that number for you, Jocelyn. I can get that
Okay.
information for you after the call. But we do work very closely with them. That is the number one resource in this part of Florida to get people signed up to quit.
1-800-QUIT. Okay.
1-800-662-4. Oh, wait a minute, that's the wrong number. I'm giving out somebody else's phone number.
Let's find it. I'll find it.
Tobacco Free Florida. I'm about to give out somebody else's phone number. I think tobaccofreeflorida.com. Quit your way. 1-877. You can now.
Yeah,
That's
it's
1-877-822-6669. How could I forget that? I've seen that commercial. 1-877 you can now. Again, 877-822-6669. And you know, just Maureen, just looking at this, people can get a 4-week supply of nicotine patches, gums, or lozenges. I know that I can't say I know, but I have read a lot and studied a lot about lung cancer, particularly after my dad's diagnosis. And it is very addictive, right? So I can only imagine how people feel who really want to stop. They'll stop. Dr. Jones and Maureen, you both are shaking your head. People will stop for weeks or even months, and then they're triggered by something in their life and will start back, right?
Absolutely.
Yeah, that's why the support piece is so critical, you know, and having a partner that really supports these people as they're on their journey to quit. There is that support component to it. It's the resources to help with the addiction piece, but there's also, you know, being able to talk to people, being able to look at those resources and, you know, to hear from other smokers who've been successful. But yeah, it definitely speaks to how addictive it is, right? Which is challenging.
Yeah, and when you talk about group support or peer support, are there group support groups? I should say, I almost say group support group, but are there groups where people actually get together to help support one another?
So these things look a little different since COVID. Pre-COVID, yes, there were lots of groups getting together. I think some of that's, I'm not 100% sure how they do that now, but I know there are still some systems that have the groups that meet in person, or the systems actually have the program running in system, and they offer it as a support group. But it's a little different everywhere. So, but if you call the 800 number, what they'll do is they'll connect you to your local resource. So it's I think you give them your zip code and they tell you what would be available in Duval County to support you.
What else does the American Cancer Society have going on as far as lung cancer awareness this month?
I mean, the main things are just, we're focused on, from the advocacy perspective, pushing to make sure that biomarker testing is approved by payers, by insurers, that everybody has access to that equally. And then we're really hyper-focused on this lung cancer screening update. You know, with that rolling out next year, we know that there's going to be a lot. I've never had this much buzz around Lung Cancer Awareness Month in my almost 9-year history with ACS. So it's very exciting when guidelines change. People, the buzz is definitely out there. So while we do GASO every year, the entire community really does GASO every year. It's not exclusive to ACS. It's just very exciting. And then getting that education out about the importance of low-dose CT screening and educating people that is something that's available. A lot of people think, well, the only cancer screenings I need to worry about are my mammogram or maybe my prostate cancer screening. They don't realize that there are all these other things that you should be talking to your doctor about. So I think that's just what I'm most excited about right now, and what we're looking at right now. And then moving into 2024, you know, all those things are going to continue to develop. I'm sure there'll be new initiatives, there'll be new programs. I'm sure that we'll see, you know, a lot of great information next year around this.
So how can individuals, you know, we have a lot of different groups of people who listen. How can individuals help? I know you all have lobbyists and such to advocate for the different tests that or screenings that you mentioned, but what can individuals do? Do you all have a letter writing campaign that they can send their elected officials?
Yes, in fact. So, number one, go to cancer.org, www.cancer.org. From there, you can learn about our advocacy efforts with our sister organization, the American Cancer Society Cancer Action Network.
ACS can.
ACS can. You know all about it, Jocelyn, with your relay history. So, anyone that has participated in our events, Relay for Life or Making Strides Against Breast Cancer, and maybe some of our other signature events, advocacy is always a big piece of this, right? We're always trying to highlight the importance of cancer research funding, the importance of insurance coverage, the importance of expanding Medicaid across the United States, things like this. These are the things that we are hyper focused on because we know that when people are insured, that they find, detect, and treat cancer, the outcomes are so much better. And so that's advocacy. ACS can. You can get involved with us. It's so easy. You become a member. We keep you updated in your area with what's happening in Tallahassee here in Florida, and then what's happening in DC nationally. And there are tons of opportunities for our volunteers to go. I actually was chosen as a volunteer to represent my zip code in Tallahassee a number of years ago. And it was so fun going and talking to the legislators about the importance. We were working on a clean air initiative, speaking of lung cancer. And there was this really tricky language in the election that year. We were voting on something that was going to impact our air quality, and it was and vaping was somehow wrapped in there, right? So we were able to go and talk and advocate and educate people about the importance of how to vote, because it looked like to me as a regular voter, I thought, well, yeah, I'm going to vote yes on this, but actually a yes vote for that was a negative thing. And so it's things like that we do, educating the public about the importance of how to vote. Voting so that cancer is funded properly is so critical. Understanding what our legislators are doing, understanding, what's important to them. I'll tell you that cancer, we are nonpartisan. Cancer affects everyone not equally, actually. Cancer affects all of us, but that's the commonality that we have. And so we don't get caught up in politics. We keep it to, we are fighting cancer and we need your help. And so volunteers are so critical. Volunteers do this work. You are the organization, honestly. You are the American Cancer Society. And so having people like you, Jocelyn, Dr. Jones, Dr. Kane, having you in the community, sharing this critical information through your podcast is so important. And we're very appreciative of that. So anything we can do to share that information with your viewers and your audience, we're happy to do that.
And as you said from the beginning, or I think I stated it from the very beginning, that cancer it is one of the top 2 leading causes of death in the country. So let's talk briefly before we end the discussion and say, how can people lower their risk of developing cancer in general? And if you'd like to just specifically focus on lung cancer, and any of you can answer.
Well,
the number one, we've been, the number one risk factor, smoking. 90% of the people that develop lung cancer are smokers. Yeah. So I think it's imperative that we start this process very early and try to get young people not to start smoking.
What about vaping, Dr. Jones? Because that's what young people.
It's probably going to be worse when we finally have the data.
Yeah.
That we've never seen people start smoking and then their lungs go completely shot within 3 or 4 episodes of vaping. We don't know what's in that. Have you looked at some of the chemicals in there?
Yeah.
And so that in of itself, I consider, when I talk to my patients, I put vaping right in there. With smoking. And, that is something that we definitely have to talk to our young people about. I had a patient the other day told me she started smoking at 6.
What?
Yes.
Vaping.
She would smoke her mother's cigarette and her mother let her smoke it. So we've got to start early. And I give it to the American Cancer Society and the American Lung Association. It's not an easy job when you're selling a product that generates income, taxable income.
Yeah.
We will never get taken off the market because it generates money to fund, governments. So we have to decrease the desire for it.
Dr. Jones,
with young people.
Dr. Jones, when growing up, one of the ways that families If your mom ever caught you smoking, they would sometimes make you sit there and smoke 1, 2, 3 packs of cigarettes at one time, and then
No way.
the belief was that you won't smoke again because you get sick smoking all those cigarettes. That's no study been done on how effective that was, but it did work for a lot of us.
I
they
never
try
heard
that
that
today.
before.
You'll get locked up.
Yeah, but you
Nowadays.
didn't hear of it, right? Correct, Dr. J? But if you did that, that's what it was. The only thing that I think one of the most important things is that we didn't cover is smoking cessation. And there are a lot of there's some, not a lot. There are some treatments out as it relates to smoking cessation. You would get that by dialing the number, Ms. McGuinn, that you mentioned. You get that, some advice on that. But one of the first things you have to recognize is the desire to stop smoking. You have to want to stop first. Other than that, everything else is not worth you pursuing if you don't initially have the desire to quit.
That's true.
Yeah. Yeah. I think too, something that we're seeing that's challenging and that we don't have the science or the data behind it yet, but we're looking for it, it's coming, is the impacts of vaping. And then people are saying, well, I'm vaping instead of using combustible tobacco. And that's a problem. We don't want one to replace the other. It's
You're
not
right.
good either way, and so we know we're hearing that from physicians quite a bit. And then, in addition to not smoking, healthy lifestyle choices, it's prevention is so important. We're treating disease where we should be preventing it, right, on the front end of things. And so that healthy living, diet and exercise are so critical, and combined with the quitting smoking or never starting smoking to begin with. So all of those things really work together. And then even environmental, if you suspect that your home has radon, things like that. If you see, there are tests that you can do to make sure that your home environment air quality is healthy. Talk to your doctor about those things. Radon doesn't exist in the entire country, those gases and things that we talked about earlier. But if you live, a great example, if you live near a landfill, there's gases that come out of that landfill, so do you need to know from the EPA what the air quality is in your neighborhood? Things like that. Those are all very important things to consider and to know, and to make sure that your physician knows about when you're having those conversations about what screenings to get.
Well, Maureen, Dr. Jones, we like to give our guests an opportunity to share their final thoughts. But Maureen, quite frankly, it sounds like you just gave yours. But I'm going to give you an opportunity. If there's anything else that, we talked about a lot, if there's anything else that you'd like to mention that we didn't ask you or that you didn't have a chance to say, now is your time.
So the name of the American Cancer Society program for smoking cessation, it's called Empowered to Quit. I'll send you information about that, and then we'll make sure that number for our tobacco-free Florida contact is correct. And then I've got the PowerPoint lung cancer presentation and some other flyers that we'll share with your community. But the main thing is cancer.org. If you need anything cancer related, we are a trusted resource. Cancer.org is not going to lead you the wrong way. You can look cancer A to Z. We can help you from anything on the cancer continuum, from prevention and early detection, treatment, survivorship, advocacy. All of those things are there on our website. So please check it out. And then I am your local resource in Jacksonville. If you have any questions about how to get connected to the American Cancer Society, really nationally, just reach out to me and I can get you connected to the right people.
Thank you so much, Maureen. And thank you also for putting your contact information in when I saw you on that meeting last week, because I surely took a screenshot of it and like, oh, I'm calling her, I'm reaching out to her. So thank you. And Dr. Jones, what are your final thoughts regarding tonight's topic? And I know the last time you were on, we were talking about breast cancer. So when you gave that little slip and said breast cancer, I know that's why we've had you on so many times. What are your final thoughts?
My final thoughts with this process is that we have to work as a community to eliminate the desire for smoking in our younger people. And we need, people say, oh, high school, too late. We have to start them in grade school, being that this is something you shouldn't be doing, and keep working with it. It can be all age appropriate, but I think it's time that the community sits down and understands that this is killing people at a later age. But if we can prevent this early enough, maybe we wouldn't be losing so many people to lung cancer.
Thank you,
So
Dr.
I
Jiggins.
leave that in the purview of the American Cancer Society to work out the age-appropriate education process. Well, by the way, y'all may get banned out of the school if you tried that.
Oh, well, we'll see what we can do. We'll see.
Hey, what are your final thoughts tonight?
Well, I agree with both our guests, what they've said. I think the biggest thing that we want to look at and understanding is smoking cessation, realizing that we now have smoking, cancer screening is very key, because I'm a primary care provider, and being a primary care provider, screening is very key. You got to understand when to screen and who to screen, and make sure that we also get counseling on this smoking cessation, as we mentioned earlier, letting people know that, there are resources out there to help them quit if they want to quit. If they don't want to quit, I hate to sound cold and sound cold, but if they don't want to quit, there's nothing we can really do for them.
Right.
And so I think if we can just make sure that people are aware, young folks, as Ken said earlier, young folks are aware of the consequences of smoking, which they obviously they feel they have the sense of omnipotence that will never happen to them. We need to somehow get that message to them. Maybe we need to show them those ugly pictures that we sometimes see on TV, of the lady that really don't like this. For them to be able to understand that smoking is not as cool. Maybe you think it's cool early on, but it will not be cool, when you're walking into Walmart with a canister of oxygen behind you, and nasal prongs, because you can't walk into Walmart. Maybe you riding into Walmart on one of those little scooters. So if we can just get people to understand that they need to, if they haven't smoked, don't start. If they have smoked, get the proper screening, ask your physician, be aware, go to thecancer.org and get the information you need to bring to your physician if they have not addressed you about it. Bring to them and get the proper screening of CT scans, and particularly those people who have smoked in the past, and so on and so on. So if we can just get our audience to be active in terms of their own health, as we say to everybody, I think we'd be in good shape.
Let me answer one question. I saw the question, how do we calculate pack years? We're using the term 10 pack years, 20 pack years. And basically, to calculate that number, you multiply the number of packs you smoke per day times the number of years you have smoked. And remember, there are 20 cigarettes in a pack, right? So just the number of packs per day times the number of years you've smoked.
And some people the first answer they give me when I ask that,
I let it burn out.
That's one of the first ones. Never smoke a whole pack. And I said, I don't care. Just give me the number. One, give me the number of years you smoke. Two, if you say you smoke, I tell them what a pack year means. A pack year means if you smoke 1 pack per day for a year, that will be considered a pack year.
Right.
Now, if you smoked a half a pack a day per year, okay, then what you do is what you just said. Take the number of years you smoked, and multiply it by that half a pack per day. So if you smoke 30 years, but you only smoked a half a pack per day by your calculation or that person's calculation, that's 15 pack years.
Yeah.
If you smoke 2 packs per day, okay, for 30 years, then that will be 60 pack years.
Right.
So that's how you make that determination. Your doctor can easily do the math if they take the time out to do it.
So pack years means what, as far as it increases your likelihood of developing lung cancer?
It's a measure by which we can determine your likelihood
Your
of
probability, right, your risk.
Your risk at it.
Thank you. Thank you all. And by the way, unfortunately, we couldn't get our guests connected, but he gave me the option of sharing his story. I won't share it like he will. We'll have him on again, but he was, I think it's in 2020 or 2021, he was diagnosed with lung and brain cancer. And fortunately for him, I text him and say, hey, you want to join us on the show and tell your story? He said, today, I'm going to read what he said to you. He said, I was at the doctor today and he said that he has beat the odds, right? So he is doing fantastic. And you know, he just is giving all the glory to God for his health status today. So we're going to keep praying for him and hoping. He is a local pastor, and we're going to keep praying for him as we know he has faith. He also, by the way, was diagnosed with COVID around the same time he got his cancer diagnosis. So he is really a walking testimony, and we're going to have him on again in the future. Thank you all for sharing your knowledge, your information. Thank you, Maureen, for sharing the resources that are available through the American Cancer Society, as well as our other cancer partners. If you've never smoked, as one of our guests said, don't start. It is very addictive. I watched my father die of lung cancer. It was very hard to, if you've ever seen your parent cry, to see when the palliative care team told my dad in the hospital one day when he thought he was having a heart attack, when in fact they said it was the cancer eating up his lung, his rib cage, right? And so he thought he was having a heart attack, and they told him at that point, if he did have a heart attack, their recommendation was that they do not resuscitate, because his lungs, his ribs were so brittle that it may puncture other organs in his body. So just chew on that a moment, folks. If you do smoke, please try and stop. I know all of us have habits that we try to shake, but a lung cancer diagnosis, a cancer diagnosis in general, is not something that any of us would like to deal with. If you want more information, your trusted source for any cancer information is cancer.org. Thank you again for tuning in to Pause for the Truth, and we'll see you next week before Thanksgiving.
Night.
Good night.
Hi, thank you.